long as they're on your hands. But if they get into other parts of your body, like into your circulatory system, they can cause some major problems. So where are these bacteria, how they get there? One example is infected tooth. Right, so if you have a tooth abscess, that could actually cause this, right? Sometimes there are some dental procedures where there might be a risk of this, okay? Because just by performing operations on your mouth, they may actually inadvertently allow bacteria to get into your circulatory system. So what do dentists often do to try to prevent that? What can they give you to try to prevent that? Yeah, antibiotics. Okay, so sometimes for certain dental procedures you have to take antibiotics. Okay, and so this is the reason why, is to prevent this type of risk. Right? Skin lesions can do this. Right, so the bacteria from the skin can get to your circulatory system. Also, some medical procedures like a catheter can inadvertently do that. Okay, so those are things that can happen because of these type of bacteria getting in the wrong place. Any questions about this?
So in the heart valves, it basically reduces the blood flow throughout the body when it becomes inflamed.
It just causes inflammation of the heart. So, and that has all the different sorts of ramifications. All right, I'm going to go back now to systemic diseases. So we're looking at diseases that can spread to the body. And so again, I'm going to focus on just certain diseases from the chapter, not every one. And I'm going to emphasize the ones that make good case studies in microbiology. These are the ones that have very characteristic disease courses. So one that we've mentioned is the plague. This is a zoonotic disease. So zoonotic, that means what?
Animals.
Animals, right? It's spread from animals to humans. Okay. All right. So Yersinia pestis is the pathogen. So this is one thing you want to keep in your head as we go through this, right? We're going to talk about diseases like the plague. You want to make sure you know what the pathogen is. Okay. Right, so you're going to be asked that to be able to match the pathogen with the disease, as well as some of the characteristics, some important characteristics about the disease course. So normally you find this bacteria in animal hosts, such as rodents. It's a common host. However, this can also be transmitted to other mammals. The way it's transmitted from animal to animal, or from animal to human, is by a flea bite. Okay, so here we go. So here is the reservoir. Here is the reservoir. Okay. But however, it can also spread to other mammals. All right, and it's done through a flea bite, and then if that gets in the human transmission, that can cause plague. All right, so going back to this is what's notable about plague is that it's one of these microbiology diseases of history. Okay, so history is actually shaped. Our human history is actually shaped by bacteria. This is one of them, right? By microbes, and there are some notable historical pandemics because of this bacteria. Because of the horrors of this bacteria, it's often referred to as Black Death. I'll explain why in a moment. Give you some examples of pandemics. There was one that went from the mid-5th century to the 8th century. 40 million deaths from that. Okay. All right. In the 14th century alone, you had about a third of the European population was decimated by plague. Okay, all right, so that's a major force going on. Yes.
Where was the first one? The one from the 5th to the 8th century.
Where was it?
Yeah, where were the deaths? Worldwide or just
This would be probably probably in Europe and probably in Europe. I mean, I was thinking about the Byzantine Empire. That's probably where it's going to be. Okay, so that area. Yeah, so it'll probably be around Europe, Turkey, that area.
Yeah, because I'd heard of the Black Death, but I had never known about the other one.
Okay. And here you can see some of the characteristics of the disease. All right, so it causes these large growths or large bulges, which are called buboes. This is from 1400s. All right, so let me give you some characteristics about the plague. So you get these enlargements of the lymph nodes. That's what these are, enlargements of the lymph nodes in the groin, armpit, and neck areas. What happens is that the bacteria can spread from the lymphatic to the circulatory system. Okay, so here we see them infecting the lymph nodes, and then they can spread to the circulatory system, causes bacteremia and septicemia. As they spread, they cause subcutaneous hemorrhaging. Right, so you have blood leakage, which results in death of tissues, okay? And actually the skin will start to blacken. Okay? That's where we get the name Black Death. When it's untreated, there's a mortality rate of 50%. Okay, so it's often a fatal disease. This is a bubonic plague, right? There's a more dangerous form of the plague, which is called pneumonic plague. So remember, this one is spread by flea bites. This one actually becomes aerosol. So it can spread from person to person by aerosol. Okay? And in that case, untreated, the mortality rate is nearly 100%. Right? So this has been in the scope of history, this has been a really big problem. However, what has changed the whole game is the arrival of antibiotics. Right? So now, we know we don't have very many cases of plague. We don't have many deaths due to plague. And the reason why, a large part of the reason why, is we have very effective treatments for these diseases. Okay? So you can do this like on an inpatient basis. You come in, you get your antibiotics, and then that will take care of the pathogen. Right? So again, just to go over this, all right, we learned that there is an animal host. It can spread to other mammals through a flea bite. Okay? It can also spread to humans through a flea bite. When that happens, you can get bubonic plague. That's one form where the bacteria spreads to the lymphatic and circulatory system. If it gets into the lungs, it has the possibility of going into aerosol form and it can be transmitted airborne. So it's a respiratory path. It becomes respiratory in terms of how it transmitted. That's particularly dangerous because that's a very easy way to spread diseases, and also now the bacteria can directly go from your lungs into your body. Okay, and so in that case, there's a very high rate of death. Okay. Any questions about this one? Okay, so that's plague. Now, I like to bring up diseases that you hear about. Here's another one. Again, this is not something where we have lots and lots of cases. We do have enough to be of concern to us. I wanted to give you some background about this particular disease since we hear about it. Where do you see a lot of cases of Lyme disease? Yeah. So actually, let me ask you a more basic question. Is there Lyme disease in the United States? Yes, there is, okay? And often you hear about, but not exclusively, often you hear about these cases on the East Coast. Why the East Coast? Yeah, so there's a lot of wooded areas, okay? All right, and so you'll see why that's important, this particular pathogen. So this one's caused by a bacteria. It's a spirochete. It's called Borrelia burgdorferi, okay? This one also gets spread through an insect, through a deer tick. Ixodes is the name of the deer tick. And usually this goes from animal to animal. we're the accidental host. So if we happen to be walking by, right, and the deer tick takes a blood meal from us, it can inadvertently infect us with this bacteria, and that can cause Lyme disease. So what normally happens is that here are the deer ticks. Okay, and so what happens is that they'll start to live off the deer. Okay, when the next generation develops, right, they may infect other mammals. So here we see a rodent being infected. Okay, and then they just go on to complete their life cycle for another deer to finish their life cycle. Right, so reproduce and make more deer ticks. Where this gets interrupted is if we come walking by and the deer tick hops onto us instead of to a deer, right? Then we can get infected, and that can result in Lyme disease. That's what we mean by accidental host. Right. So this explains why we find this in wooded areas, right? Because these are animals that tend to hang out in wooded areas, and so that's where you find most cases of this disease. Right. So there's always concern about, as we develop more suburbs, we go more and more into the wooded areas. Right. There's always concern that this could become more and more of a problem because the Lyme disease is there. Okay, so what happens after you get bitten by a tick is that you'll get a rash, and this rash has a very characteristic pattern. Okay? First of all, it becomes larger and larger, grows, and it looks like a bullseye, like a target sign. Okay? And it will actually start to migrate outward over time. So they call those erythema migrans, or EM, and it's accompanied by flu-like symptoms. So that's why you see this picture here, right? That's actually that rash developing. So this is actually the stage that you're supposed to treat the disease if you want to avoid getting the long-term consequences. Is when you see that rash develop, right? So ideally, when you go through this, you want to get treated. The way you treat this is with antibiotics, right? So early treatment with antibiotics. If the disease progresses, then it goes through other stages. So there's actually a second stage where now you have neurological symptoms. So meningitis, encephalitis, you have peripheral nerve abnormalities, you have cardiac dysfunction. Right. After that, if it's still untreated, you can go into a third stage, a late stage, where now you'll get arthritis. Okay? What happens is that after your immune system gets rid of the bacteria, there are still immune complexes floating around, and this can accumulate, especially in the joints, and cause arthritis. Right? So this becomes a long-term problem for patients who have untreated cases of Lyme disease. Right? We actually know that the disease has been around for a while when historians, probably microbiology-oriented historians, look at, let's say, journals from pioneering days, and they hear people describing their health condition. They know from just the way they describe it, by comparing with current cases, that those individuals back in the past must have had late-stage cases of Lyme disease. Okay, right. So this pathogen has been around. Right, any questions about this? I am going to pass out a worksheet to you, so I'm going to do that right now.